Hello everyone, I'm Dr. Amir Al-Khair and today I'm going to talk to you about iron deficiency anemia. To start off, did you know that iron deficiency anemia is the most common anemia worldwide? Now, the prevalence is highest in children less than 5 years of age, in young women of childbearing ages due to their blood loss menstrual, and in pregnant lady due to their increased demand. Okay, the reasons for iron deficiency anemia, they can be categorized into 4 categories. The first one is inadequate intake. That happens when our diet is not rich with iron. Let's say we don't eat spinach, or we don't eat red meat, or liver. All of that can cause iron deficiency anemia. The second category, what if we are taking our need of iron? What if our diet is filled and rich with iron, but we still have iron deficiency anemia? Well, that can be the reason in inadequate absorption. You see, that would be the case in trophic gastritis and in Crohn's disease and in ulcerative colitis. The third category, it is increased demands. We see that in pregnancy and in severe illness. The fourth category, it is increased loss of iron. That one we see in gastrointestinal bleeding and in menorrhagia. Now, the signs and symptoms for iron deficiency anemia, they are very general, very wide, they can be anything. But to name a few, the general symptoms are something like fatigue, lethargy, pallor, which can especially be seen in the conjunctiva, and hair loss, brittle nails. That happens when our nails are weaker than they should be. They keep breaking, they keep peeling. In the long run, it can cause a deformity in the nails, something we call spoon-shaped nails. It can also cause angular colitis, which is inflammation and fissuring of the area right here. This gives a little bit of a burning sensation. It can also cause dysphagia, but that in the severe cases. As for the cardiac symptoms for iron deficiency anemia, well, it starts with tachycardia, which is rapid heart rates. You feel your heart is beating inside your chest. Angina, which is chest pain, and breathlessness on exertion. Moving on to the treatment of iron deficiency anemia. You see, we usually start with oral supplements like ferrous sulfate. That is indicated to all the patients with iron deficiency anemia if they tolerate it. The dosage should be approximately 100 to 200 milligrams of elemental iron per day if you want to make the process faster. If you want to enhance the absorption, you should take vitamin C with it. Let's say if you take the supplement, the iron supplement, and you simultaneously drink orange juice with it. Well, you're going to enhance the absorption of the iron and you're going to make the process faster. Something very important that I feel the need to point it out. After your iron levels go back to normal, you should keep taking the treatment and the supplements for at least 3 to 6 months in order for your iron stores to build up. The intravenous therapy, we usually go for this therapy, the intravenous, in case the oral therapy was contraindicated or it didn't work. Let's say you have inadequate absorption. Well, it's not going to work in this case. Or in case the patient decided they want to go with the intravenous therapy. Because sometimes the oral therapy can give a bit of a stomach ache. As for the dosage and the length of the therapy in the intravenous therapy, well, that actually differs depending on how severe your anemia, how severe your iron deficiency anemia, and what is the infusion that you are taking, what is the type of IV intravenous iron that you are taking. That's it for today, guys. I hope you liked this video and I hope that I helped you. Please, if you did, subscribe to my YouTube channel, go to the comment section, put anything you have for me, whether it was a suggestion or a question, and I'll be happy to help. And guys, stay safe.